At the start of the COVID-19 pandemic, healthcare workers put their own safety at risk and kept going to work to care for their patients. Communities initially put up thank you signs and cheered from their houses, but this has long stopped. The general public has found it easy to forget the hardship healthcare workers are still facing today. Yet doctors, nurses, and other healthcare experts continue showing up to work each day to battle the pandemic. This has taken a dramatic toll on healthcare workers, with nurses being some of the hardest hit. Thousands of healthcare workers have died from COVID-19, with more than half of healthcare workers reporting symptoms of burnout and other mental health crises. Before we dive deeper into this topic, what is burnout? Burnout is an occupational hazard in healthcare, which harms the healthcare system, patients, and healthcare workers. During COVID-19, burnout has increased to levels that pose a threat to maintaining a functioning healthcare workforce. Elevated burnout and other indicators of stress are expected to persist long after the pandemic. Today, we are going to interview Nurse X, who has chosen to stay anonymous for privacy concerns. They work in a Toronto hospital in the critical care unit, and in this interview, we'll discuss how the pandemic contributed to worker burnout in themselves and colleagues.
All right. So before the pandemic, I'm a critical care nurse in a downtown hospital in an ICU, a busy ICU. And prior to the pandemics, we had our challenges in nursing, but it was nowhere near what we faced during and post pandemic. And I think the biggest challenge that we faced was staffing shortage. And, adding this to high acuity with these patients who were so sick, and having to nurse them and things like that became very, very challenging. And it made for a very demanding work life. We landed up, not having as many nurses. Every time you walked into a shift, you're always so short. You're dealing with these super sick patients. You've got the fear of the unknown in terms of what you were possibly bringing home to your families, what you were possibly, contracting yourself. There was a lot of stress, worse, much more worse during the pandemic than before. I think it impacted all of healthcare in varying degrees at different stages. I think, when it came to respiratory therapists, they were impacted a really big deal in terms of having to deal with the respiratory challenges faced by these patients. When it came to any other sort of allied healthcare, it was definitely a really huge challenge. But I think I can't really speak too much to their professions and their how it would have impacted them. But I think most importantly, I think nursing took the biggest hit. And the reason we took the biggest hit is because of our staffing shortage. It landed up having the most lasting effects when it came to us as a healthcare profession, because people started burning out. People were leaving the hospitals left, right, and center. We were landing up having hardly any nurses to work with at the time when we needed them the most, at the time when we needed all of healthcare to kind of rally around and kind of work together. So I think it impacted all of healthcare in varying degrees, but I think the nursing took the biggest hit. So aside from the staffing shortage, I would say that it was a higher than normal stressful environment. We were in unknown territory. Things were changing and evolving hour by hour, minute by minute, in terms of the conditions of these patients and things like that. There was a lot of emotional strain, especially in the early days of COVID. Again, like I mentioned earlier, fear of the unknown. What are we going to contract? What are we going to be bringing home? We had hospitals that were setting us up in hotels to work our shifts. Like stretches of our shifts and stay in the hotel, so we were kind of minimizing our exposure back to our families, back and forth, going in and out of the hospitals. Long work hours, really long work hours, sleep deprivation, and fear of what you're bringing home, and overall emotional exhaustion. And I think for a lot of us, there was a moral component as well when it came to this, that we were not able to provide, and to this day, there is this huge moral component. We are not able to provide for our patients the care that they truly need, because we have all this big long list of stuff that's preventing us from being able to do that. And for nurses who, nursing is a calling, right? It's not something for everybody. And when you go into the profession to want to help people, to want to ease their pain, to want to make their life better even by 1%, and you're not even able to do that because you're so short staffed, you've got all these other issues, you're in such a high stress environment, there's a huge moral component and guilt associated with that, where you feel that this patient is not getting the care that they truly deserve because of these factors.
Wow, thank you. That was a really well articulated answer.
So I think this is a very multifaceted approach. I think it needs to be implemented, from right at the top, from an organizational level to a structural level, and then on to individual levels. Good, strong leadership is vital, right? Because the biggest issue we are facing is this burnout. So the leadership is what needs to be vital and important in order to ease this issue, in order to help with this issue. Adequate staffing is really at the top of the list. From an organizational perspective, promoting wellness, allowing for nurses to have mental health days, encouraging staff to take care of themselves. All those would be big issues that I would say would be important. Supporting this moral distress. What can they do to help us in this moral distress that we are in right now? Maintain safe working conditions. There was a time when we had PPE shortage, where we were, having to reuse N95 masks and things like that. That was scary times. Retention benefits for the staff who are already working, current staff, through financial compensation, supportive workplaces, ensuring that they hire new staff who are what should I say, got the appropriate training to be able to work in these environments. And
Right.
I think offering, I think hiring is the is the biggest thing. Getting us the appropriate staff and is the biggest problem, right? Or the biggest issue, I would say. Some of the things that they've done is they've offered double time on nights and weekends. So if you need to work a night or a weekend, the incentive is to get double pay. They've also have a standby pay, where if you're available to work a shift, you tend to go on like a standby list, and you get paid a certain stipend or whatever to be on the standby list should you get called in at short notice. So that has kind of helped a little bit, where people have put themselves available to be called in back at short notice, and they have made a significant effort in terms of hiring. It's still not enough by any means, because the nurses are leaving just as fast as they're hiring them, and because of the burnout. But definitely this double time, this standby pay, things like that have really helped to a degree.
Right. No, exactly. As much as possible for what has been done as of now.
Mm-hmm.